This is the wrong slide set. Can we try again? While he's changing the slides, I want to thank you for the chance to be here with you this afternoon. And this is my first visit to the Emirates, and I'm having a really nice visit. Thank you. What we will talk about do you all know how to tell the differences between the sciences, biology and chemistry? If it moves, it's biology. If it smells, it's chemistry. If it doesn't work, it's physics. This is an example of physics. We're waiting for the technology to work. Yes. What I have for you today are some brief notes on preparing written patient education materials. A little background on types of health communication. In the largest sense, we have health information, which is awareness information generally targeted to the public, undifferentiated audiences, usually through the mass media. This is an example of awareness information. It doesn't have much information, but it says stop diabetes. That's the message. It's a simple graphic and easily understood. Next we have health education, and this is where we are basically looking at information for what we call the early sick or the worried well. And they are beginning to move into the healthcare system. And so it's a more specific audience. They have more specific information needs. And this is an example of a handout that you might have for health information. You can see it's got some risk factors there. The logos at the bottom are important because they establish the credibility of the message, which is something that's oftentimes overlooked. And then we have patient education, which is information directed toward people who are identified as patients, and they're part of the healthcare system at this point. It's usually used to either explain the disease, describe the condition, or treatment options. And this is sort of an example of that. This graphic focuses on you, the patient with diabetes, and then some of the specialists that you will come in contact with during your treatment. Okay, the purpose of patient education handouts is more than just conveying information. One of the purposes is to raise awareness. The more people are aware of their condition, the better they are able to deal with it. Sometimes there is the need to persuade patients that one set of behaviors is better than another. And you can use techniques of good writing to produce that change. You can encourage behavior change through theories of persuasion and so forth, which we'll talk about. And finally, another purpose is to teach behaviors. It's not enough to tell someone they need to eat better. You may need to teach them how to eat better. And I think that this is the take-home message here. Information by itself is worthless. Knowledge doesn't have any value until it is used and acted on. And so what you want is a handout that focuses on what you want patients to do. Part of it's what you want them to know, but what is it you want them to do? Now, spoken messages are very quickly forgotten. Here's an example from some interesting work done actually a long time ago, but it's a very repeatable experiment. If you start off with 25 facts, and the first person reads the handout and gets 25 facts, and then tells the second person about half of those facts don't get transmitted. The third person, again, loses information until finally you end up with only about 20% of the original message. So if the doctor tells the nurse, who tells the mother, who tells the father, who tells the babysitter, sometimes you have a very low information product. If you have this person here reading the same handout as the first person, then you don't have that loss of information. So what makes a good handout? Well, they have to be available. If people can't get it, then they can't read it, they can't follow the instructions. It has to be appropriate. It has to be compatible with patients' values and lifestyles. If you approach change too quickly, you will generate resistance and not acceptance. And finally, they need to be visually appealing. The 4 characteristics that we're looking for in any good communication are listed right here. How well do readers understand the information? How well can they remember the information? How quickly can they find it? And most importantly, how well can they use it? These are the 4 criteria you want to use to evaluate your handouts. Yes, it can be well written, it can be good grammar and so forth, but how well do people understand, remember, find, and use information? Test the handout with some of the patients that you're working with. They're the ones who will tell you if these things are happening. The handout also needs to be consistent with the other information that patients are getting. So you can imagine if the handout says one thing and the physician says another. That produces confusion, and that's not a good thing. When we talk about writing, and this is true writing in any language, I think, the 2 things that we really have to focus on are who is your audience? And not just who are they as diabetes patients, but rather how old are they? Are we dealing with both men and women, or boys and girls? Perhaps what is their economic status? What is their education level? Be as specific as you can. Okay? What do they want to know? What do they need to know? What do they not know? And what do they think they know that isn't so? These are the questions you need to ask there. And secondly, what is your purpose in writing? And notice that the verb here is to do. What do you want the patient to do after they've read the handout? If you can't answer that question, you're not ready to write. We want to focus on behavior, not just information. What communication medium will you use? Slides are a completely different medium than print. And an image that works very well on a printed page may be too complicated for a slide. So if it's a web page, people will read things online. That's going to be different than a printed page. And finally, what is the overall context of the communication? In this case, it's probably a patient-physician interaction. But look at the ideas and the attitudes that people will bring to the situation, because that's where the communication takes place in this particular context. Now, in communication, we usually talk about 3 kinds of information, and I have found this very useful in my own work. Information is that which reduces uncertainty. Information is that which reduces uncertainty. Now, actually, the phrase came from the people who invented digital electronics, so it's a very important phrase. But kinds of uncertainty, ambiguity, doubt, hesitation, anxiety, these are all instances of uncertainty, and information should be able to reduce those. Awareness information is just that. It's the awareness that there is something out there, there's help. Someone has a problem, they don't know what to do about it. Awareness information says there's something that can help. The example here is exercise can help your back pain. Now that's not enough, but you have to have awareness information before you go anywhere else. And the second kind of information is how-to information. Once the person is aware of exercise or treating the back pain, how do they exercise? What do they need to do it? Lie on your back with your legs on a chair to relieve your low back pain. Okay, I know how to relieve my back pain now. First I learned it was possible, now I'm learning how to do it. And the third kind of information is called principles information. And this is explaining to the patient why it works. And this is important for two reasons. First of all, adults usually need to have a reason for doing something. They aren't going to do it just because you tell them. You're going to have to give them a persuasive reason why this should be done. And secondly, it allows the patient to solve problems when they're in a new situation. So for example, we have flattening your low back takes pressure off the lumbar disc. This is principles information. Well, the patient finds himself in a position where they can't lie down. What do? Well, they learn that they can flatten their low back if they put one leg on a short stool. And so they've been able to solve their own problem because now they know what the principle is behind making their back feel better. In terms of specifics, we want to use informative titles. How many of you know what incentive spirometry is? How many of you want to know what incentive spirometry is? Okay, it's a respiratory therapy that's used. If you have a handout that has this title, you have to know what incentive spirometry is to know that maybe you need to have it. So instead, make it an informative title. An informative title links the patient's need for information with what's in the text. Why we want you to use an inhaler after surgery. That's to restore lung function, of course. Sometimes you can say, what is an incentive spirometer? But questions are hard because it has to be a question that the patient would ask. Otherwise, you'll miss them. In general, we want to talk directly to the patient. Be as personal as possible. Okay? We'll see that you're taken care of. It's informal, it's supportive, the personal pronouns make it more direct. The one exception to that is if you have bad news. People with this disease may become permanently disabled, which is a little more acceptable than you have this disease, you're going to become, disabled. That's a little too direct, at least for most Americans. We want to use familiar words, by all means, familiar words. We have another one, myringotomy. How many of you want to know what a myringotomy is? Yeah, I don't either, but it's some sort of ear thing, right? Caring for your ear tube. It's concrete, they're familiar words. This is what you want to have. Images work very well. In this case, you can show someone what a bunion is in an instant. People can understand it. There really doesn't need to be much text about it. Images are good. Just for formatting purposes, and these actually count, try to limit the lines to 55 characters. Lines that are longer than that get harder to read. Make the text flush left and ragged right, because we use the end of the line to read down the page. If you have justified columns, the spaces between the words varies, and that's very fatiguing on the eye. So flush left, ragged right. Short paragraphs and bullet points. It is a PowerPoint world. People don't read paragraph after paragraph anymore. They want short paragraphs and bullet points. And space paragraphs to make it look easier. Here's some examples. What do you think? Easy to read? No, you don't even want to read it, do you? It looks too dense. You can see the spacing is strange, and even though the margins are straight, it's really not inviting. Which would you rather read, the top or the bottom? How many say the top? How about the bottom? Yeah. That space between paragraphs makes all the difference, as well as the line length. Remember, you have to read the handout if you're going to get anything out of it. So you have to make it as easy to read as possible. If readers don't understand, if the patient doesn't understand, some will reread until they do understand it. Others will stop reading and they will begin to experiment on their own, which is not what you want to do because probably they won't do it right. And some simply stop and give up completely. I have a communication exercise that I often do with the people that I train. And it involves following instructions and assembling a puzzle. And you can see when the person who is following instructions has lost track of what's happening. And their face just drops, they simply sit back, and they can't do anything because they don't know what to do. They haven't been given correct instructions. Visual cues are wonderful. These are very good for helping people find information quickly if you use the same symbol for the same kind of information. And they also help people remember information. Memorable images. I really like this one. Because it's an unusual image, people will remember it. And that's what you're looking for, is to remind them of what the topic is. Lists also help people remember. If they know they need 5 things to change the bandage, and they can only think of 4 of them, that's a clue they need to go back to the handout and look for the 5th one. We call these mnemonic devices. These are memory aids. So for example, rest, ice, compression, and elevation. It's what you do for a sprained ankle. It's easy to remember this. How many of you can name the planets in order from the sun outward? Anybody? Okay, in America, if you have an 8-year-old child, you know how to do this. Okay? My very eager mother just served us 9 pizzas. Okay? So my is Mercury, very is Venus, eager is Earth, mother is M, J is Jupiter, U is Uranus, 9 is Neptune, and Pluto, even though it's no longer a planet, is the pizza. So by giving you that phrase, my very eager mother just served us 9 pizzas, I have made you all smarter, because now you can all list the planets in order from the sun, and that's what good patient education is doing, is giving people something that helps them remember the message. Create associations. I particularly like this one. An aortic aneurysm is a ballooning of the wall of the artery. So you give them a concrete image, and everybody knows what a balloon is. They can imagine it being inflated and then popping, which of course is the problem with an aneurysm. Again, use personalized examples so that people can see themselves in the example. Alopecia is a condition where all of your hair falls out. Cancer patients, for example, will have this. And it's very stressful, especially for women. And so here's a description of Sally, who has the same condition the patient has, and they're showing what they did to help Sally out. And this is reassuring and increases the credibility of the handout, I think. Humor is wonderful, but you have to be careful because there are lots of cross-cultural differences. The handle on a recliner does not qualify as an exercise machine. Now, how many of you know what a recliner is? Okay, it's a nice soft chair, and you pull the handle, and the footrest comes up, and you go back, and it's very, very comfortable. So if you know what a recliner is, this is funny because you know it's not an exercise, another exercise equipment. Here's another one. Your x-ray showed a broken rib, but we fixed it with Photoshop. Now, how many of you know Photoshop? Yeah, this is not good. So if you know Photoshop, you can understand the humor. If you don't, then you can't. But use humor when you can. The next couple of slides, I'm going to just highlight one or two. You will have copies of these somewhere. I don't know if they will be posted or given as a handout. Do you know? Okay. If you want the slides, let me know. We'll make sure that you get them. When you write instructions, lots of things begin to matter. Describe how and why what you're going to tell the patient works. This is that principles information. Okay, give warnings and cautions or exceptions. Help people help you. If they're doing something wrong or their symptoms appear, you need to make sure that they know how to get help. Give them a name to call and a phone number to call. And, I learned this the hard way, call the number and make sure that whoever is supposed to answer it, answers it. Because if you don't, sure enough, you're going to get the wrong department, so you need to check that. Make sure that you've defined all the words that you use. Now, in general, you want to use very common, simple words. But sometimes you need to give patients the technical terms because that's what they're going to hear when they get treatment. And you simply need to make sure that they understand what those terms are. And again, the other items on these three slides are important, but we won't take the time to talk about them. This is the example that I just suggested about who to call and how to contact them. Now, as I mentioned, the purpose of a patient education handout, or actually the purpose of any written communication really, is to change people's behavior or to help them change behavior. And here are some ways to do that. The first thing you want to do is establish a good relationship with the patient. You do that through the handout. You use personal pronouns and include personal examples, but establish the relationship. Treat the readers as competent adults. In America, for a long time, we had a problem with the doctor telling patients what to do. And this did not work well, because adults want to make their own choices. They want to know why they are being asked to do something. So you treat the reader as a competent adult. And one of the ways that you do this is to take a risks and rewards approach rather than this paternalistic one. So instead of saying, you have to change your diet, you put it as risks and rewards. If you continue to eat your present diet, your chances of developing diabetes will increase by a factor of 3. On the other hand, if you change your diet now, you can reduce your weight, lower your body mass index, and reduce the possibility of getting type 2 diabetes. And throughout, you need to be positive and encouraging. Nobody wants to read bad news. People want to know that there's hope and that they can do things. Now, it turns out that not everybody wants to know the same information about the same process. Some people want to know the facts. In America, this is pretty much the myth, okay? The one thing a man in America cannot afford to do is to look foolish. And we're supposed to endure anything, right? That's what a good, strong man can do. So we're ready to endure anything, but you have to tell us the facts because we don't want to do anything that's foolish. Now this is mostly men, but there are certainly women in this category as well. And other people want to know what the experience is like. They don't really care why it works. You know, will I be uncomfortable? You know, what will happen to me? 2 or 3 days later, are there side effects and so forth? And so it's best just to give information in both of those areas. How many of you are familiar with the health belief model? Okay, good. Very, very useful model. This is sort of a short version with 4 ideas. People respond to the health messages best, first of all, when they believe they are at risk. So this is why you have to make it personal. It's not, somebody with your body type might develop diabetes. It's you are at risk of developing diabetes. You have to get their attention. You have to persuade them that they have a problem, they are at risk. They have to believe that that risk is serious and immediate, that they can't wait much longer. They have to do something now. And then you have to persuade them with what is called response efficacy. If you do the things in this handout, the risk will be reduced. You need to be credible here. You need to say this is the information, why it works, this is the experience of having it. But the last part of this, personal efficacy, is you have to persuade the person that they really can follow the response that you are remembering, that you are recommending. So, again, just a real quick summary. Oh, maybe not, I don't have the background. Okay, so tell them what they need to do to reduce the risk, and then persuade them that they in fact do have the resources, the physical resources, the psychological resources to follow through with that. However, if the risk is perceived as being too great, you're going to generate either denial or anxiety. And neither one of these things is where you want to be. Some people need more time and more information to adjust. If you can work that in your handout, that's fine. But what you want to do here is produce just the right amount of risk and not too much risk. Okay, so here's a diabetic foot. This image is probably a little too much for most Americans. This is a threat, but it's too much. You're going to get denial and anxiety, I think, with a lot of people with that. So instead, you might do something like this. Here are the complications that you risk with diabetes and the corresponding heart disease. And then just close with some very common principles of persuasion, although we sometimes don't think of them as that way. Consistency is simply the need to be seen as consistent and not as haphazard or unorganized. So show your love for your grandchildren, get them immunized. So behave the way grandmothers are supposed to behave toward their grandchildren. Care for them, make sure that they're immunized. Make the behavior consistent with what your culture is telling you. Credibility. Our patients come from all over the world, so your message says it's credible because it has that. And lastly, the concept of framing, which is a fascinating area. People have gotten Nobel Prizes for working with framing. There's compelling evidence, for example, to show that if you say the procedure has a 10% failure rate, fewer people will choose to have it than if you tell them that the procedure is effective in 90% of all patients. This is a loss frame and this is a gain frame. And there's much more we could say about this, but this is why you need to be positive throughout, because that improves the chances of adherence to the recommendations. that's all I have for you. Are there any questions?
Thank you very much. Thank you. Wonderful. Thanks very much, Professor Lang. That was wonderful. I think really educating all of us on how to educate our patients or people, because